Hi, everybody. My name is Chris Lynch. I'm the Deputy CEO and Director of Policy Communications and Publications at Alzheimer's Disease International. Delighted to be joining you for this session at the Alzheimer Europe conference online this year. And today I want to talk to you briefly about From Plan to Impact, progress towards the World Health Assembly's Global Action Plan on Dementia. For those of you that follow our work at Alzheimer's Disease International, you will know that since 2017 at the World Health Assembly, when the WHO launched the Global Action Plan on Dementia, ADI has been generating an annual progress report looking at both the progress, but also some of the barriers to progress in the 7 key action areas of the report. This year was particularly poignant. It's the 3rd year, and at some point this year or later this year, the WHO themselves will produce their first interim report. But of course, COVID-19 has entirely changed everybody's lives in 2020. And our report From Plan to Impact 3, Maintaining Dementia as a Priority in Unprecedented Times, also reflects this. We delayed the publication date slightly. Normally it would go live at World Health Assembly with a side event in May. We delivered it a couple of months later, and rightly so, not to distract at all from what at the time, particularly in Europe, was the peak of the pandemic. The report did give us an opportunity to start to reflect on some of the impacts of COVID-19, and you'll see this through a number of the upcoming slides as well. I would wholeheartedly recommend that you go to the ADI website and have a look at this report. It is broken down into the 7 action areas. Some great graphics in there as well, so you can see visually how countries are progressing in all of those 7 action areas. And it's accompanied by some expert essays and case studies. This map that we update on a continual basis is really poignant for us. You can see the dark red colours are countries that have already launched dementia plans, national dementia plans. And then you can instantly see from the lighter red across what is still the majority of the world, how many countries have still to launch their national dementia plans or responses to the WHO Global Action Plan on Dementia. Now, there was some really good news during the COVID period. 4 countries did launch their plans: Germany, Iceland, Dominican Republic, and very recently, China. And the other good news is that there are approximately 30 countries that now have plans in development as well. However, there is still a long way to go, and we are of the firm belief and opinion that a national dementia plan is the best tool and the best strategy for tackling dementia for governments at national level. Just to help a little in terms of perspective of the scale of the challenge, when you look at the number of dementia plans that have become available over the last year since 2015, and then on the right-hand side of this graph, you see the red bars, which equate to the equivalent of 26 new plans every year until the end of the 2025 period to create national dementia plans. The sheer scale of the task is incredible, but there is momentum, and we are now starting to see response, particularly in some key areas, Eastern Europe, and also in Africa. We are genuinely hopeful that there'll be the first plan in sub-Saharan Africa in 2021. So for my final slide, I wanted to reflect a little bit on the impact of COVID-19 on the Global Action Plan on Dementia by future gazing. So we suspect that there will be continued interruption to support and social services. Post-diagnostic support, face-to-face support for people with dementia has been severely disrupted right across the world. We are starting to see some examples of face-to-face support returning in different ways, in innovative ways, but it is a huge barrier and a huge hurdle for people living with dementia and their carers. We are extremely concerned about political deprioritization of dementia as well. When each of the 194 member states of WHO signed up to that global plan, they made dementia a priority. And of course, there are now going to be competing uses for time, for money, for resources, but it's essential that we keep dementia at the forefront of people's thoughts. We're also extremely concerned about the impact of COVID-19 on diagnosis rates, and we know that diagnosis is being delayed, and the knock-on effect of that is often that people will transition even before they have a diagnosis. Disruption to research and clinical trials is also a key and poignant point here. Perhaps 2020 might bring us the first major drug breakthrough that we have all so much been waiting for. But ultimately, we have to ensure that clinical trials get back on track and research does not get too badly disrupted by COVID-19. And of course, we're all waiting for a vaccine at a global level, but access and safety, especially for people with dementia, is an incredibly important point. So thank you so much for your time. I would ask that you go to the ADI website and have a look at that report from Plan to Impact 3. Thank you.